Hi, my name is Dr. Geoff Kerchner. I'm a behavioral neurologist. I see patients with dementia. One question that I get asked a lot is the role of genetics in Alzheimer's disease. I think that people have this kind of natural intuition to think, well, maybe my mother had Alzheimer's disease and so I feel like I'm destined to get it. Or neither of my parents ever had dementia and I feel like I'm good, I don't have any risk. And of course, it doesn't quite work either way. So there is a very, very rare way of getting Alzheimer's disease. There's a few families around the globe that harbor mutations in their DNA such that parents directly give the disease to 50% of their offspring. We call this autosomal dominant inheritance. This is a very rare way of getting Alzheimer's disease, and patients in those families who get Alzheimer's disease, who inherit one of these mutations, usually get symptoms in their early 40s. So it's a very young onset disease. It's different from what most of us think of when we think of Alzheimer's disease, because for the rest of us, we get what's called sporadic Alzheimer's disease, and sporadic is sort of the opposite of familial, meaning it's not directly inherited. Now, genetics does play a role in sporadic Alzheimer's disease in the same way that your risk for high blood pressure or diabetes will be influenced by how many family members you have who have that condition. Likewise, in Alzheimer's disease, if you have a strong family history, people in your family who have it, this raises your risk, but it doesn't mean that you get Alzheimer's disease from your family, if you understand that distinction. There are some genes that are known to carry some of this risk. The ApoE gene is the one that we know the most about. We all have an ApoE gene, actually two of them, one from mom and one from dad. It comes in 3 different flavors, 2, 3, and 4. There's not an ApoE1, I don't know why, there's just 2, 3, and 4. And it turns out that ApoE4 is what carries the risk for Alzheimer's disease. And so if you inherit a copy of this, you're at an increased risk compared to somebody who doesn't have it for getting Alzheimer's disease in your life. But importantly, it doesn't mean that you will get the disease. And I have patients who have severe forms of Alzheimer's that they got in their 50s who don't have the gene. And they also don't have that autosomal dominant type that you directly inherit. And we actually don't have any great explanation for at least genetic explanation for why those patients got the disease. So my main point is that genetics has an imperfect relationship with whether or not an individual is going to get Alzheimer's disease. It influences the risk, but there's a lot of other risk factors too. That's my expert tip for the day.